According to the National Dental Centre Singapore, NDCS, children with severe early childhood caries before the age of 6 doubled, from about 500 in the year 2000 to about 1,000 in the year 2012. In 2014, the Straits Times reported that more than 50% of children in Singapore have one or more rotten teeth by the time they start primary school, and that the proportion of children with dental caries remained high, at 50% in 2013. A survey conducted at SOTA's open house found that 52.5% of children aged 5 to 9 had oral caries and that 76.4% do not floss their teeth. Dr. Ong Yen Si, a specialist in pediatric dentistry, attested that although diet is the most important factor of good oral health, it remains the main aspect which lacks awareness, and that dental health among children has not improved, despite oral health care programs in schools, a fact also confirmed by Dr. Tan Wee Kiat of the NDCS. Given that there's an incomplete understanding on how to maintain good oral health in Singapore, resulting in oral caries remaining high since 2003, how might we educate children aged 5 to 9 and their parents on the proper oral health practices so that they will take more ownership of their own oral health, leading to a decrease in oral caries among children in the year 2017 and beyond? A common misconception is that oral caries only result in bad breath, pain, and discomfort. However, medical research has shown poor dental health increases the risk of diabetes, respiratory problems, cardiovascular diseases, strokes, mouth cancer, and adverse pregnancy complications. Furthermore, dental treatments are expensive. A simple instruction in Singapore can cost over $100, and major treatments range in the thousands. The problem of poor oral health can be explained by the 4 I's. 1. Ignorance. Many parents are not aware that diet and contact time between food and teeth contribute more to poor oral health than the correct dental habits. 2. Indifference. Not knowing about other health impacts, many ignore oral health issues as treatments are easily accessible. 3. Improper diets. Not many know that besides sugar, other foods can also affect oral health. 4. Improper eating habits. Many children take longer times to chew and eat, resulting in increased contact time between their teeth and their food. To combat these causes, we developed a 3-phase plan of action to address the issue. Phase 1. Combat ignorance by raising awareness through public outreach. We wrote a book, My Teeth Hurt, created posters and a kit for outreach. The kit contains a brochure, an information card with information on proper oral health care, toothpaste and mouthwash from our sponsor, Flocril, and a 30-day challenge card to encourage children to follow good dental care habits. Phase 2. Targeted outreach to children and parents. We outreach to Shaw's Preschool, Keppel Road Baptist Kindergarten and Zhangde Primary School to distribute our materials and kits. We also put up skits to explain about the various aspects about proper oral health and the consequences of poor oral health. We also collaborated with the National Library Board to present our skit during their storytelling sessions to reach more children and their parents. We also targeted parents, as many may be ignorant and hence indifferent about good oral health, by collaborating with parent magazines such as New Age Parents, Singapore's Child and Mummy's Market to feature articles about proper dental care for children. We will also be sharing a booth with our sponsor, Flocril, at the Kids World Fair 2017 to reach more parents and to perform on the main stage to educate both parents and children on oral health. Phase 3. Collaboration with other stakeholders. To ensure greater and further reach and sustainability, we will work with the Health Promotion Board, HPB, to put up our material on their website and distribute our 30-day challenge cards to all kindergartens annually. We will also work together to review the current dental health curriculum to create an extensive and engaging oral health program to combat the 4 I's of poor oral health nationwide, beginning with the children. Our plans also include publishing articles through HPB's Health Hub app and placing our brochures and storybook in dental clinics, schools, and public libraries. Finally, we will work with HPB to improve the current Healthy Meals in Schools program to reinforce the importance of good diet for oral health, creating better diets and awareness among children, and work with government organizations to revise guidelines on permitted levels of sugars and acids in foods and drinks sold in schools. Through this project, we could see how even a small step in the right direction could impact many young lives. We also realized how little knowledge could lead us into a false sense of security and to take things for granted. Thank you. This is brought to you by Project Bite Size.